The 27th of January, 1945. The Red Army enters Auschwitz, the largest of the extermination centers located in German-occupied Poland. It is estimated that a minimum of 1.3 million people were deported to this camp between 1940 and 1945, and of these, at least 1.1 million were murdered. However, not all of its prisoners died. In this Nazi factory of horror, the Soviet soldiers liberate more than 7,000 surviving inmates, who are mostly ill and dying, and some of them were subjected to cruel and painful pseudo-medical experiments performed by one of the most sadistic Nazi doctors. His name is Horst Schumann. Horst Schumann was born on the 1st of May 1906 in Halle, then part of the German Empire. When Horst was 5 years old, his parents divorced. Following the separation, he remained with his father, a practicing physician. However, when his father's second marriage also ended in failure, Horst was primarily raised by his older sister. Despite these early challenges, he chose to follow in his father's footsteps and pursued a career in medicine. In 1930, during his university studies, Horst Schumann joined the Nazi Party. By 1932, he had become a member of the SA, or Sturmabteilung, the Nazi paramilitary force also known as the Stormtroopers or Brown Shirts, due to the color of their uniforms. On the 30th of January 1933, Adolf Hitler was appointed Chancellor of Germany by President Paul von Hindenburg. That same year, Schumann obtained his medical license and began his professional career as an assistant doctor in the surgery department at Halle University Hospital. In November 1933, he married Frieda Meyer. After 10 years, however, the marriage, which produced 2 sons, ended in divorce. From 1934 onward, Schumann was employed at the Public Health Office in Halle, and in 1939 he was recruited into the Luftwaffe, the German Air Force, where he served as a physician. The Second World War began on the 1st of September 1939, when Nazi Germany invaded Poland. In October 1939, Schumann met Viktor Brack, who was chief of Main Office II in the Führer Chancellery in Berlin. During the meeting, they discussed Schumann's involvement in the Nazi Euthanasia Program, codenamed T-4, which was the systematic murder of institutionalized patients with disabilities in Germany. Schumann's first assignment was to establish a killing center for the mentally ill and disabled at Grafeneck Castle in Württemberg. In January 1940, the first transport of 25 men arrived from a sanatorium and nursing home near Munich. Upon their arrival at Grafeneck, they were murdered in the gas chamber. Schumann remained at Grafeneck until the summer of 1940, during which time more than 1,200 patients were killed under his supervision, using carbon monoxide gas. Before being killed, the patients were examined by hospital doctors, and some were given sedative injections to calm them. These examinations, which lasted only a few seconds to a minute, were conducted to verify the identity and medical records of the patients. Once the examinations were complete, the patients were sent to the gas chamber. The doctors then operated the manometer, releasing carbon monoxide gas into the chamber. After approximately 20 minutes, when no movement was detected inside, the gas supply was stopped. Over time, many of the doctors became desensitized to the mass killings, and some even made callous remarks such as, "They're already tumbling over." Schumann was later transferred to the Sonnenstein killing center, where under his supervision nearly 14,000 patients and over 1,000 concentration camp prisoners were killed in a gas chamber between June 1940 and August 1941. Before assuming his role as the head of the Sonnenstein Center, Schumann completed a several-week psychiatric training course with Professor Werner Heider, the medical director of Operation T-4 at Ravensbrück University Hospital. Just before Operation T-4 was officially halted in August 1941, Schumann was appointed as an expert for a medical commission. Codenamed 14F-13, this commission was tasked with selecting concentration camp prisoners deemed unfit for work or incurably ill. Starting in April 1941, a panel of doctors began visiting concentration camps to identify sick and incapacitated prisoners for elimination. To expedite the process, camp commandants prepared preliminary selection lists. These lists included the names of prisoners considered dead weight, those who had been unable to work for an extended period or were severely incapacitated with no chance of recovery. Prisoners were sometimes encouraged by camp administrators to come forward if they felt ill or unable to work. They were told that they would be sent to a recovery camp with light duties. Many prisoners believed this lie and willingly volunteered. However, after being gassed at the killing centers, the victims' belongings were sent back to the camp warehouse for sorting. This revealed the grim truth to the remaining prisoners, and even those with serious illnesses stopped reporting to the infirmary. Schumann came to Auschwitz for the first time in the end of July 1941 and selected 575 prisoners who were taken to Sonnenstein Center for gassing. He carried out further selections in the Buchenwald, Dachau, Flossenburg, Gross-Rosen, Mauthausen, Neuengamme, and Niederhagen concentration camps. From December 1941 to April 1942, Schumann transferred to the Eastern Front, where he was deployed to set up an emergency hospital in Minsk. In the autumn of 1942, Schumann was ordered by Hitler's chancellery to transfer to Auschwitz and begin sterilization experiments on prisoners using X-rays. The aim was to develop an efficient method to permanently prevent reproduction among those deemed genetically or racially inferior. Heinrich Himmler, the head of the SS, had assigned several doctors to research and test various methods of sterilization. One of them, Professor Karl Klauberg, conducted his own experiments at Auschwitz, where he developed a technique for sterilizing large numbers of people without surgery. He achieved this by injecting a chemical preparation specially developed for this purpose into the fallopian tubes, causing them to become severely inflamed. This led to coalescence and thus to blockage of the ovaries. In November 1942, Schumann began his experiments in Block 30 of the Women's Infirmary at Auschwitz-Birkenau. After sterilizing around 200 Jewish prisoners, he expanded his research in February 1943, when the experiment station was moved to Block 10 of the main Auschwitz camp. There, he began radiation experiments on female prisoners. The process involved exposing the reproductive organs, testicles in men and ovaries in women, to radiation. Schumann tested various radiation doses and exposure times to determine the most effective method. For many victims, these X-ray sterilization procedures caused severe burns and painful infections, particularly in the abdomen, groin, and buttocks. These injuries not only led to excruciating pain, but often resulted in agonizing deaths. To confirm the effects of his experiments, Schumann ordered the surgical removal of irradiated ovaries. These procedures were carried out by prisoner doctors who reportedly performed 4,000 surgical experiments without anesthesia. Some young women died from complications following these brutal procedures. One of the inmates who experienced Schumann's medical experiments was a Polish Jew named Chaim Balitzki, who provided his testimony after the war during the Nuremberg trials. Like many others, Chaim was subjected to horrific X-ray sterilization experiments, during which his testicles were exposed to high doses of radiation, causing severe burns, swelling, and excruciating pain. Before the surgical removal of his testicles, Chaim was given an injection in his back that numbed the lower part of his body, while leaving the upper part fully conscious. He later recalled being able to see the entire procedure reflected in the mirror of a surgical lamp. There was no prior examination, no consent sought, and no regard for his suffering. Chaim was left permanently sterile, his body scarred and broken. The physical agony was compounded by psychological torment as he endured the humiliation and dehumanization of these experiments. While some victims died from infections or complications, others like Chaim lived with lifelong trauma. Ultimately, X-ray sterilization proved ineffective for large-scale use. In April 1944, Schumann submitted a report to Himmler titled "On the Effects of X-rays on Human Reproductive Organs," in which he concluded that traditional surgical castration was faster and more reliable. Yet, Schumann's note suggested, in a factory with 2 tubes, approximately 150 to 200 people could be sterilized per day. With 20 factories, this would mean 3,000 to 4,000 people per day. As a result, he ended his sterilization experiments at Auschwitz that same month. According to French author Frédéric Coderc, who in his book Out of Reach in detail describes Schumann's crimes during the Second World War, as well as his post-war activities, Himmler wasn't the only one involved in Schumann's experiments. It was learned that Adolf Eichmann, one of the major organizers of the Holocaust, attended Schumann's experiments. Whilst at Auschwitz, Schumann also performed typhus experiments by injecting people with blood from typhus patients and then attempting to cure the newly infected subjects. Schumann left Auschwitz in April 1944 and was transferred to the Ravensbrück concentration camp, where, according to Frédéric Coderc's book, he was sterilizing and castrating 120 to 140 Romani children as young as 8. He also injected silver nitrate into the uteri of young girls and conducted X-ray-based experiments. Witnesses saw him in Ravensbrück in civilian clothes with a medical kit. He then divorced his first wife and married Josef Aputz, the office worker he had met at the Sonnenstein killing center, and this marriage produced 3 children. In January 1945, Schumann was sent to the Western Front as a troop doctor, where in June 1945 he was captured by the Americans. Schumann spent 8 months in a detention center for Nazi criminals in southern Germany, but as American authorities failed to connect him with his criminal activities during the war, he was released. Schumann and his wife then moved to the town of Gladbeck in West Germany. At first, he worked as a sports physician for the city, and in 1949 he opened his own private practice. However, his past caught up with him in January 1951, when Schumann applied for a hunting and fishing license in Gladbeck. A routine police background check revealed that he was a wanted man, but due to slow-moving investigations, Schumann managed to flee the country in February 1951. For the next 3 years, he worked as a ship doctor. The first clue to his whereabouts came in February 1954, when the German consulate general in Osaka, Kobe in Japan reported that Schumann had obtained a German passport. By 1955, he had moved to Egypt and later settled in Sudan, where his wife eventually joined him. After his presence was exposed in April 1959, Schumann fled through Nigeria to Ghana, where he set up and ran a jungle hospital in the small town of Ketekrachi. In 1962, a reporter from the British newspaper Daily Express tracked down Schumann and his wife in Ghana, but an extradition request filed by West Germany in 1961 was ignored by Ghanaian President Kwame Nkrumah, who considered Schumann a friend. On the 24th of February, 1966, Horst Schumann returned home from a hunting trip, unaware that the Ghanaian president, his protector, had just been overthrown. A few weeks later, Schumann was arrested and held for 4 months in Usher Fort Prison, the same place where enslaved people had once been chained before their forced journey across the Atlantic. On the 17th of November 1966, Schumann was extradited to West Germany, and during the flight he made his only confession when he said the following about his dark past. "The accusation of euthanasia is true. I was the man responsible at Sonnenstein. I performed sterilizations with X-rays at Auschwitz. It was a bad thing we did." Once in West Germany, Schumann was placed in pre-trial detention at Butzbach prison in Hesse. The charges against the Beast of Block 10 at Auschwitz were severe: active participation in mass murder in the gas chambers, the killing of prisoners through X-ray irradiation, and performing operations as part of large-scale sterilization experiments. On the 23rd of September 1970, the trial of Horst Schumann finally began before the Frankfurt Regional Court, 19 years after the first arrest warrant was issued. According to Friedrich Koderk's book, Out of Reach, when Schumann appeared in the packed courtroom, he was nearly smiling. The prosecution presented a mountain of evidence, 4 volumes of documentation weighing 2 tons, which included testimony from 115 survivors. Schumann was charged with the murder of 30,000 Jews. During the trial, he shockingly admitted to killing as many as 80,000 Jews, but added, "I have no numbers." Schumann's former assistant described him as the devil himself, who refused to give water to women despite their pleas, later sending them to gas chambers or the brothels of capos if they were less injured. Friedrich Koderk writes in his book that after a few months of hearings in March 1971, Schumann claimed he suffered from stomach issues and hypertension. He faked illnesses and even self-harm to delay proceedings. The court suspended the trial, citing his supposed health problems. On the 1st of November 1971, a medical report detailed his chest pains, irregular heartbeat, dizziness, and headaches. In July of the following year, he was released from prison due to his heart condition and rapidly deteriorating health. Referring to Schumann's former comrade Adolf Eichmann, who had been executed in Israel in 1962, prosecutor Fritz Bauer declared, Eichmann would have been delighted to be tried in Germany. He would have only received a few years in prison. In the end, Schumann never faced true justice for his crimes. When he died on the 5th of May 1983 in Frankfurt in West Germany, he was 77 years old. There were no tears shed for Horst Schumann.
Thanks for watching the World History Channel. Be sure to like and subscribe, and click the bell notification icon so you don't miss our next episodes. We thank you, and we'll see you next time on the channel.